Welcome back to my channel. In today's video, we're going to be going through pelvic wands and how they can be used to help decrease pelvic pain associated with conditions like vaginismus, painful bladder syndrome or interstitial cystitis, endometriosis, radiation fibrosis from cancer treatment, and dyspareunia or pain with sex. I'm Dr. Alex Hill, your physical therapist for everything pelvic health and oncology, so let's dive in. So first, what is this thing? This is a medical device that you can use for soft tissue massage and mobilization at the pelvic floor muscles. Because those pelvic floor muscles are really deep in the pelvis, utilizing a pelvic wand is really helpful to actually get to those deeper pelvic floor muscles and help decrease your pain. But this tool should be used as just one part of your overall program to manage your pelvic pain. It's not always just about the pelvic floor muscles if you have pelvic pain. It often takes stretches, exercises, managing your stress, optimizing your sleep and your dietary habits, and working with a healthcare team to truly get your pelvic pain under control. That includes working with a pelvic health physical therapist, working with a counselor, working with pain management, a gynecologist or a urologist or a urogynecologist. So again, with pelvic pain, don't rely just on one or two different things. Make sure that you have a comprehensive program. Because the pelvic wands have different sizes, you can use the pelvic wand either vaginally or you can use it rectally. So it doesn't matter what your gender is or what genitals you have, using a pelvic wand can be beneficial to help address those deeper pelvic floor muscles. I love this pelvic wand from Intimate Rose because it has a short, wider end. That's really helpful to get to those more superficial muscles that are closer to the vaginal opening. Or you can flip it around and use the thin end either vaginally to get those deeper pelvic floor muscles, or you can also use it rectally, again, to get to those deeper pelvic floor muscles. These pelvic wands you can also get in two different sizes, a wider one and a thinner one. For reference, that's about how wide it is, about as big as my index finger. And the wider one is a little bit bigger than my thumb, that you can see here. And these you can get through current medical technologies. I'm going to include the links for all three of these pelvic wands in the description below. When you use a pelvic wand, you should not have any significant increase in pain, and you should use very gentle pressure and movement. So you don't want to be giving a ton of pressure down and moving it really quickly. You want to ease into those movements and that pressure. If you're using a pelvic wand like the Intimate Rose one that has a silicone covering, you want to make sure that you use water-based lubricant so it doesn't break down the material. If you're using a plastic wand that's a plastic or acrylic, then you can use any type of lubricant, and that includes water-based, oil-based, or silicone-based. Now, before we actually get into how to use the pelvic wand, make sure that you are first assessed by a medical provider if you have pelvic pain, and especially work with a pelvic health physical or occupational therapist. They'll do a full assessment head to toe to really find the driver of your pain and make sure that they're able to give you an appropriate individualized treatment plan for you. Remember I said earlier, a pelvic wand is only one part of a program, not the whole program. It's important to use the specific guidelines and instructions on how to use pelvic wands to make sure that you're using them safely and effectively. So let's get into the general steps for how to use the pelvic wands. Step one is preparation. So you're going to wash your hands. You're going to wash the pelvic wand thoroughly before and after each session to make sure that you keep it clean. You're going to find a comfortable, private space where you can relax during the session. If you're using the wand vaginally, then it may be helpful to lie with pillows or a wedge under your upper body to help elevate it and make it easier to reach, and also use some pillows under your knees to help support your legs. If you're using it rectally, it's likely going to be easier if you lie on your side. Step two is going to be adding that lube to the end of the dilator that you're using to reduce friction and decrease irritation. The third step is insertion. So you're going to gently and slowly insert the pelvic wand into the vaginal canal Or again, if you're doing it rectally, on your side, you're going to slowly and gently insert it rectally. Once you have it inserted, listen to your body and go at a pace that feels comfortable and pain-free. We're then going to work on muscle release. So once it's inserted, focus on becoming aware of the sensations and any areas of tension or discomfort. So you're just going to kind of slowly sweep, explore the pelvic floor, and apply gentle pressure with the wand. If you feel and you find any trigger points or areas of tension or discomfort, you're going to gently press into that area, hold that pressure for 1 to 2 minutes, do some deep breathing, and let go and relax the pelvic floor. If it becomes too uncomfortable or painful, then return to that spot at a later time with less intensity. Next, you can do sweeping. So you're gonna start in a smaller range and you're going to just sweep along the pelvic floor muscles to help with releasing any tension. This is especially helpful if you have radiation fibrosis from cancer treatment or if you have any scarring from surgeries. With the wand, you wanna explore different depths, different angles, to really find those areas that are causing discomfort or that have a lot of tension or fibrosis or scarring. And this is just another view for you to see how that wand can be moved. It does take a couple times of using it to get the hang of it and feel comfortable using it. Once you're done, again, make sure you wash this thoroughly and wash your hands and then put it away. If you're just starting out and if you have higher pain levels, only spend up to 5 minutes using the pelvic wand. As you get more comfortable using it and your pain levels are improving and they're decreasing, you can spend even up to 10 to 15 minutes working with this pelvic wand throughout that whole pelvic bowl. You can use the pelvic wand a couple times a week, but if you have increased soreness or discomfort the day after, then take that next day off. Remember, discomfort's okay, but nothing should be increasing your pain. I hope you found this video helpful. If you did, please like it and subscribe to my channel so you don't miss any new videos on how to manage your pelvic pain.